Hello, my name is Browne. I'm a senior speech and language therapist with the Cork Kerry Mental Health Services. As a speech and language therapist, I work with patients and I support them to understand their communication and swallowing needs, and I empower them on their path towards recovery. I suppose as a speech and language therapist, to begin with, is a professional who's qualified in supporting people with communication difficulties to function in their everyday lives. That might involve working with both patients as children and adults. We work with patients of all ages. As a speech and language therapist, our profession is based in science, and we study topics such as neuroscience, linguistics, anatomy and psychology. A speech and language therapist works directly with patients, or we can work in a group setting, both individually or in group, depending on the patient's needs. We tailor our interventions to suit the patient's needs. So if a person warrants speech and language therapy, they will meet with a speech and language therapist and they will explain to them I suppose the nature of, they'll explain to them what it is that they're going to do and the interventions that they offer, which might include things like, I suppose, attending a social skills group, working directly with people on their language difficulties, providing them with support strategies or compensatory strategies to help them navigate social situations in terms of the language difficulties that they experience, and also working with their families and friends to train them in order to support the person so that stressors are reduced in their everyday environment. We work directly sometimes with people who have swallowing difficulties eating, drinking and swallowing, and that kind of intervention might involve working with people to develop a safe eating plan, which would identify the kinds of liquids and both fluids and, I suppose, foods that would be safe for them to eat to prevent them from developing complications. In terms of my role, I suppose I work directly with families and with people from a wide range of all across the spectrum. In terms of mental health difficulties can often co-occur with communication difficulties, and actually by targeting specific communication difficulties you can in fact improve someone's mental health and help them on their path towards recovery. Speech and language therapy referrals in the context of a mental health setting are made through the mental health team. If you need a referral to speech and language therapy, or you feel that it would benefit you, it would be advisable to contact your mental health clinician and to ask for it, that a referral be made. Once a referral is received by the speech and language therapist, they will then go and meet with you, and they will listen and ask you some questions to identify if speech and language therapy is needed. This might involve completing questionnaires, which might be completed by yourself or members of your family. After that, a speech and language therapist might usually offer a speech and language therapy assessment, which can actually take place over the course of a number of appointments. During this assessment, they would tailor the assessment and specifically design it with you to support you in identifying your strengths and your needs. And from there, they would make a plan with you, or I would make a plan with you, going forward to identify how I could support you. You would be part of that decision and part of designing that plan, so that it would facilitate you in supporting your communication skills, which would have a knock-on effect in terms of supporting your path to recovery. So speech and language therapists work with a wide range of difficulties. This can include a speech clarity issue, a difficulty with regard to your voice or vocal hygiene, with regard to your ability to understand others or to use language. We also work sometimes with patients who have difficulty with eating, drinking and swallowing. I suppose the reason I became a speech and language therapist is because I wanted to help people and to support people with their communication and swallowing needs. It's a really interesting role to have, and I enjoy working with people, especially in a mental health context, because I can see firsthand how the impact of communication can impact their mental health. And by actually working with them and working with their families and friends, I can support them on their path to recovery.